Time now is 9:37. The statistic over 30 million Americans living with diabetes is pretty eye-opening. That's almost 10% of the population. But advances in medicine, treatment, and technology have actually made it possible for people to truly live and thrive with this disease. Dr. Joseph Henske is not only the director of the UAMS Diabetes Program, but he also has diabetes himself as a testament to that statement. Thank you so much for stopping by today, Dr. Henske. Let's first just talk about, diabetes itself. Remind our viewers what it is and what it does to the body. I know there are different types, but let's just start with the overall general diabetes.
Yeah, absolutely. Diabetes is essentially having elevated blood sugar levels, having high glucose levels. For many people, they may not realize it. They may start to have some symptoms like fatigue or frequent thirst or urination, and over time that can lead to complications as well with the eyes, with the kidneys, with the feet. A lot of people don't realize that diabetes is the leading cause of blindness in the United States.
Wow.
It's the leading cause of kidney failure in the United States, and as well as it increases your risk of heart disease by 2 to 4 times.
Okay, 2 different types. Let's go over type 1 first.
Absolutely. So we've talked about, I have type 1 diabetes. I was diagnosed when I was 15. Essentially, type 1 diabetes is an autoimmune disease. This is where your body starts attacking your pancreas and reducing the amount of insulin that your pancreas can make. Insulin is what makes your blood sugar levels come down. It's a hormone. And if you have type 1 diabetes, which is only about 5% of people with diabetes, you have to take insulin. That's really the only treatment. If you have type 2 diabetes, which is, again, much more common, about 95% of cases of diabetes are type 2. This is insulin resistance. So oftentimes, especially early in the course of diabetes, you actually make lots and lots of insulin, but your body is resistant to it. So your body is unable to use that glucose properly, and your glucose levels remain high.
So what are the causes? I know that they're very different as well. Like type 1, what are some of the risk factors, I guess, you'd associate a type 1 diabetic with?
Absolutely. Type 1 diabetes, again, it's an autoimmune disease. So essentially, you're not going to be at a high risk unless you have a family history of autoimmune diseases. If you have a family member who also has type 1 diabetes, but a lot of people may have thyroid disease or adrenal insufficiency. There are other autoimmune diseases, lupus, that show an increased risk of type 1 diabetes as well in people who have those diseases.
And type 2?
In type 2 diabetes, the main thing that we have to think about is weight. The heavier that we are, the more insulin resistance that we carry. Most of the time, we're going to see a family history with that as well of type 2 diabetes. And so we're really thinking about risk factors. People maybe who had gestational diabetes, who had diabetes during their pregnancies, they're also going to be at high risk. There are people with polycystic ovarian syndrome as well. Those are high risk of type 2 diabetes.
All right, so technology is ever advancing in every field, in every realm, and including this one. What are some of the advances that have made it possible for people with both type 1 and type 2 to not just kind of, tote the line and survive, but really thrive and live their lives the way they want to?
Absolutely. Technology, for me, for someone who's lived with diabetes for 27 years, has completely revolutionized my experience. When I started with diabetes, I was giving insulin injections via vials and syringes, and I was sticking my fingers with a glucometer. Now we have devices called continuous glucose monitors. These are devices that you can wear either on the abdomen or on your arm, and they will track your blood sugars 24 hours a day, 7 days a week, without doing any finger sticks.
Wow.
These devices can show you when your blood sugars are high, when your blood sugars are low, what's happening in the middle of the night. If you're a parent of a child with type 1 diabetes, these have completely revolutionized your experiences. When your child is acting crazy, as all children do. I have 5 little kids myself.
You certainly don't.
You're not wondering, does my child have a high blood sugar or low blood sugar? Because this technology, these devices can actually send the child's blood sugar reading to your phone, and you can get an alert when their blood sugars are high or low. This is really personalizing management, because we all know that in general, diabetes can be fairly simple. It can be, what are you eating, and what medications are you taking, and how much exercise are you doing? But everyone's life is different. And what you see with a continuous glucose monitor is all the variations that you get from day to day, and different people have different jobs and different stress and different activity.
Well, this is a way that you can not only survive but thrive, and you can do that with UAMS. So you can always contact them with the information on your screen, whether you have questions about diabetes or anything else. They'll take great care of you over there, and make sure you follow them on Facebook, Twitter, and Instagram as well. Thank you so much, Doctor, for coming in today. We appreciate you explaining all this to us.